Okay, good morning. It's so wonderful to see so many of you here. I want to thank you for being here with us as we continue our efforts to help to improve men's health and quality of life. We will also be celebrating the accomplishments of our men's health champions who reflect the communities we serve and are champions for equity and social justice. Whittier has hosted its annual Men's Health Summit for 23 years, and the goal of the summit is to highlight the gaps in men's health and to help to address preventable causes that contribute to increased morbidity and mortality rates. Throughout the day, we will explore strategies to advance men's health, raise awareness about why it is important to engage with men and boys to improve their health and well-being, and provide health education resources and access to care. This year's theme, United for Men's Health, Grounded in Equity, was chosen to highlight the need for unity and partnerships. No one person can do it alone, as we tackle health inequities for men and the negative impacts on their families. Across the nation, gaps in health are large, persistent, and increasing, many of them caused by barriers set up at all levels of our society. After all, it's difficult to be healthy without access to good jobs, schools, and safe and affordable homes. Health equity means, I have a slide on health equity. Health equity is the state in which everyone has the opportunity to attain full health potential, and no one is disadvantaged from achieving the potential because of social position or any other societal defined circumstance. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of disparities in health. Addressing disparities in health and healthcare is important not only from an equity standpoint, but also for improving the nation's overall health and economic prosperity. When all of us are healthy, the nation will prosper. People of color and other underserved groups experience higher rates of illness and death across a wide range of health conditions, limiting the overall prosperity of the nation. Racial, ethnic, and gender disparities, as well as other social determinants of health, all intertwine and impact achieving equitable health care for all. That is why we're highlighting this issue again today. We hope that during this summit's discussions, presentations, and interactions, we will continue to address the behavioral differences and causes for gaps in men's health and brainstorm interventions to redefine health equity. As always, Whittier is so grateful to have so many of you, so many friends and supporters who believe in our mission. We tap into a village. Glenn will tell you. Everyone will tell you. As soon as you step into my village, you're in. So thank you to our supporters. So thank you for our supporters who believe in our work and are listed here. We have so many of you. Why does health equity matter? The disparity in life expectancy between men and women is relatively new, emerging in the 20th century due to an increase in deaths linked to chronic disease. It persists throughout the lifespan of men from infancy through older age and exists in all but a handful of countries. In the United States, health equity and equal opportunity are linked, and the burdens of disease and poor health and the benefits of wellness and good health are inequitably distributed among groups of people. In 2015, it is expected that people of color will account for over half of the population, according to the US Census Bureau. But if we continue to suffer from ill health, high mortality and morbidity rates, we will increase in numbers, but the struggle will continue. So that's why we're focusing on this, because we want to grow in numbers. We also want to share in the power and the resources. Many of the things that, and for a healthcare institution, many of the things that are barriers to health, as great as healthcare is and beautiful clinics, there's a study that came out a couple of years ago that says 50% of what makes us healthy is our lifestyle. 20% is our environment. Only 10% is attributed to access to healthcare. So as great as Whittier is and all of these wonderful institutions, it's these social determinants of health that impact us. Economic stability, income inequality, poverty has a bigger impact on our health than anything else. Education and educational level, healthcare access, neighborhood environment. If your environment is not safe, and when we say neighborhood environment, we're looking at safe housing conditions, home ownership, pollution and crime, and also, lest we forget, the social contacts, race and racism. The leading cause of death, according to the Boston Public Health Commission in 2021, for BIPOC men, Asian, Black, Latinx, are cancer, heart disease, and accidents. But as you can see, unfortunately, Black men on average have the highest rates of these causes of death. More Black men died of cancer than those of any other racial group. This points to further inequities and often connected to racial issues and also unconscious bias that exists in healthcare. I'm sure many of you have heard about the life expectancy gap. And what we've done is in 2007, there was a data that was released that said the average life expectancy of a person living in Roxbury is 59.5 years compared to a person living in the Back Bay. And through Whittier fashion, we are that small engine that could, nothing, we launched what we call our Boston Health Equity Program. And the Boston Health Equity Program is actively working with our patients, community leaders, and partners to remove barriers to good health, promoting health education and lifestyle changes. BHEP, as we fondly refer to it here, is a system of care for those with chronic illnesses as well as those who are at risk, to connect them to community outreach, wellness support services, linkage to social services, and care coordination to eliminate health disparities and their associated costs. Through BHEP, patients will get a personalized form of care that points them to the necessary services which can help them better manage or prevent chronic illnesses. Recently, WBUR and Boston.com wrote articles about the 11-year history of the Whittier Street Health Center Boston Health Equity Program. We couldn't do it alone. We had so many partners that helped us along the way. But what it said is, if you make health equity a strategic priority, if you make any issue a strategic priority, whether you're a small health center or a major institution, things can happen. So the gap has now closed from 59 years to 69 years. That's still young. That's still a 23-year life expectancy is still unacceptable, because many of us would be at the door of that number. And we were. And no, present company included. I speak for myself. So that's why I'm a Roxbury girl. That's why we have a vested interest in continuing to address this issue. So we do, including the Boston Health Equity Program, we also, overlooking the issues of health equity, is acknowledging and actively working to dismantle these deep disparities. So I have a list of programs here that we've launched. Another way we try to bridge the gap is through a program we call Prescription for Health. The Prescription for Health program focuses on activities that have proven to improve physical and mental health. Through the pandemic, we heard a lot about mental health and mental wellness and substance use disorders. So we work, our providers give patients a prescription for health that links them to, did you all know that we have an almost 7,000 square foot gym? I took Glenn there in the basement. So if you ever want to come exercise, it's here. But it links them to our community garden, our teaching kitchen, the fitness center, and they work with a coach to help them in the journey. I mentioned that we've been hosting these summits for 23 years, and 20 years ago, I'm a mother of 3 sons. My father passed away at 67. Every male in my family passed away before the age of 70. So we all have a reason why we tap into something. And this year, my older brother celebrated 71, so we're bridging the gap. My oldest cousin celebrated 73 years, so there is a celebration. So this is something that is happening in my family as well. Our men's health program, which was launched 20 years ago, is an innovative, comprehensive outreach, education, screening, and referral program designed to link men and boys to primary health care and support services offered for Whittier. And we also work with a lot of our partners. Across racial and ethnic groups, men and boys in Boston are less likely to have a primary care provider. And so we're linking our patients. Our goal is to promote health equity by reducing premature mortality among BIPOC men and boys and low-income people by providing education, screening, connection to services, and enrollment for uninsured. Believe it or not, in a Commonwealth that has a 95% insurance rate, 28% of our patients don't have insurance. And we provide care regardless of your ability to pay for service. And we make sure that that is not a barrier that our patients have to deal with. Encouraging men, we encourage our men to advocate for themselves, to organize and undertake structural changes to reduce inequality, connecting incarcerated men to case management and re-entry services. So we have people that go into the House of Corrections in jail and connect people prior to their release. And if you ask, the top 2 needs of our incarcerated men, housing and jobs. They want to work. Yeah. And offering violence prevention programs designed to strengthen our community. We also recently just opened a day engagement center that is in a trailer on the side of the building. And we hear so many stories about people on mass and cast. And our team, the Whittier team, has successfully launched this day engagement program where on-house people can come from 8:30 to 5 p.m., be connected to primary care, behavioral health services, recovery services, but also help them with skills development, housing, and linking them to services. And knock on wood, since October 2022, when we launched the program, there has not been an incident, none of what you hear. And the people that come to our Day Engagement Center are highly motivated and they want to change their lives. They're so protective of the Day Engagement Center that we've launched this leadership, what we call POL, a popular leader. So they go out and advocate and recruit other folks and very seriously say, we can mess this up. This is a safe place for us. So they've served as ambassadors and are linking people to care. So again, as great as I mentioned, 50% of what keeps us healthy is our lifestyle. Many of the issues that are barriers are housing, job, the transportation. So what we do is we've become a healthcare and social services organization, because as much as primary care and medicine and behavioral health is important, if someone is diabetic and they don't have a safe and affordable housing, they cannot be healthy. HIV services are important, but if they cannot take their medication and be connected to care, it can happen. So again, I want to thank all of you for your commitment to health equity. We can close the gap by 10 years, and we need to close that 23-year gap. It can be done. We can be united and grounded in equity. We have so much more work to do, and I know I can count on all of you for your support. Thank you. So now we have a Men's Health Champion Award presentation. He's one of our ambassadors. Bonjour. He's like, I gotta go. Today, in addition to continuing our work, if you notice, I kept saying continuing because there's so much that needs to be done. We are blessed to have so many people who exemplify resiliency, community, and hope. Their accomplishments and character make them outstanding role models for our community, for young people to aspire to achieve. Each and every one of these men I've known over the years, and many of them, it's been long overdue, so I'm just thrilled that we were able to do this today. So, as you can see, Wilner Augusti, Reverend John Finley, Reverend Art Gordon, David Morales, Jean Prizo, our very own Jean Prizo, William Watkins, and Leverett Wing. Let's give them a round of applause. Our first honoree, Wilner, is the founder of Haitian Americans United. I believe Haitians are the largest black immigrants in Boston, and Mr. Wilner launched HAU and has been a cultural force in Massachusetts. Where's Mr. Wilner? He's not here yet? Okay. That's Mr. Wilner's brother right there. He works for us 35 years. So, Wilner has been a cultural force in Massachusetts for over 40 years. He's the founder of Haitian Americans United, an organization that hosts several annual patriotic events like Haitian Independence Day, Flag Rising, Ceremony for Haitian Heritage Month in May, the Haitian American United Parade, and more. He migrated to Boston in 1973 from Port-au-Prince and has been a pillar of support and success for the Haitian community. Wilner has done so much to support our mission and support the Haitian population that we serve. So let's give him a round of applause. I'm sure he'll share. Our next honoree is Reverend Finley. He's the co-founder and head of the Epiphany School. I heard of him and met him in 1998, and it's just been wonderful. Epiphany School, for those of you who don't know, Epiphany in Dorchester is a tuition-free Episcopal school that works with families after their first trimester, like us, we start working with our mothers from when they are pregnant. So after the first trimester of pregnancy, and stays with its students throughout their academic and professional career. He has been involved in launching other educational initiatives such as the Nativity Prep School in Boston, Codman Academy Charter School, and 30 Epiphany-inspired schools across America and overseas, and more. Reverend Finley serves as an associate priest at St. Mary's Church in Dorchester and is also affiliated with the Church of the Redeemer in Chestnut Hill, both places that I've been. So I said, I'm an Episcopalian, we call them Anglicans, and we're usually the quiet people. So in all of my work in Boston, folks would say, what church do you belong to? Because they assume I'm. So we, Episcopalian, can do evangelism. We can go out there, we may be stiff when we're in church and quiet, but we can, every now and again, we even bring a gospel musician to our church. So I was just so thrilled because, again, Epiphany is based on the Episcopal values, and so many children are benefiting from it. We work with Epiphany School and our school-based partners. So please join me in welcoming Reverend Finley to the podium.
Very much. It's nice to have, they refer to us Episcopalians as God's frozen chosen. Yes, my hips are actually bolted to my shoulders. This is all the movement. It's wonderful to be back in this neighborhood. The Nativity Prep, we started in '92 just down the street at St. Francis de Sales. So it's great to be back in the neighborhood. Thank you. Thank you. In terms of men's health, I think it's something that we really engage in at Epiphany. One of the things, as you may know, with daycare vouchers is that moms have to stay low income, and there can't be another source of income, i.e. the father, right? So we, by having a free program, we'll take the voucher, but we say to moms, we want you to lose your voucher, right? And I'm very pleased to report that of our first 6 cohorts, every mom in the first 3 cohorts has lost her voucher because she's making too much money and the dad is involved, right? That's what you want, right? The other thing we really believe in is building family wealth. So every baby when it's born gets a $3,000 529 plan for college. So they know that there's some funding for their future. Frederick was talking about the social emotional part. So part of our program is we take 27 people a year who get room and board and health care, 20 grand off their college debt and a free master's degree in education. The goal is to have Epiphany graduates and kids like them to come back into the community and become teachers, right? So today, after running this program for 25 years, a third of my teachers are former students of Epiphany, and half of them are black men, right? So there are lots of great role models. Right? And the last thing I'll talk about is that we have a program called Sister Sister for Girls and the Brotherhood for Boys, and really providing that support late at night on Saturday night, community service things, and that honest sharing with each other that really builds it up. So if you're ever over by Codman Square, over our area, we'd love to see you. On Wednesdays, we have this amazing van, so you can get your vaccines, courtesy of Whittier Street Health Center. Epiphany is a great place. The head of the school is kind of a bow tie wearing jerk, but the school is awesome. So we'd love to have you if you ever want to come visit. We love having visitors, and we're in school all year round, so you can come anytime you want. Thank you. It's an honor to be here. Thank you very much.
Is Mrs. Gordon here? Portia? So, you're all good? Okay, I knew I saw you. Okay, wonderful. So Reverend Gordon's wife is here. He's our next honoree. Thank you, John. One thing that I'll say, Reverend Finley, we also have, when they're recruiting for students for the Newark, we have the signs here. So if you have a child that's looking for school, come to Whittier Street Health Center. We are a partner. We want the kids to be at Epiphany School. Since childhood, Reverend Gordon was active in the church as a youth choir member, junior deacon, and junior usher. He attended Savannah State University, where he served in several leadership roles with the school government, and AWCP, and more. He went on to receive a bachelor's in history and graduated with honors and a master's of divinity from BU. During his time at BU, he was awarded the prestigious Donald Wells Prize for Preaching for Excellence in Preaching from the Boston Theological Institute and the Massachusetts Bible Society in 2015. He was also an honoree for the Garner Prize for Preaching. Reverend Gordon became the assistant to interim Pastor Jeffrey Brown at St. John's Missionary Baptist Church in September 2016 and was voted pastor-elect in 2017. One thing I'll say about Reverend Gordon, again, like Reverend Finley, he's been talking to us about bringing a health clinic to the church because he believes that if there's a clinic embedded there on Wednesdays and Sundays when there's a captive audience, there's so many, hypertension is known as a silent killer in our Black community, and so many people are walking around. So that's part of what we're working on right now, and I've continued to work with him. So Reverend Gordon's wife and daughter are here to receive the award on his behalf. Reverend Gordon is traveling, but she gets the award. Come on.
It's been a while, but girl, you still got it. Good morning, or good, yes, it's still morning. Good morning, everyone. My name is Portia Franklin Gordon, and my little girl over here, Jackson. We are so excited to receive this award on behalf of Art Gordon. He's traveling with our church to Pennsylvania, so he could not be here. But Art is so passionate about men's health, particularly because of his father, particularly because of his mother, and other people that unfortunately have gone on too soon because of things that quite honestly could have been prevented. And we are staunch supporters of health, particularly Black men. We have a church community that is 55 and older, most of our parishioners, and many of them are Black men. It is unfortunate that we hear stories and conversations about men not wanting to go to the doctor. I serve a large 18 to 24-year-old college population, and it really worries me when we have to talk about, hey, we need these forms for college, and they have not seen a doctor since they've been younger. And they're talking about their pediatricians, and I'm talking about getting them a primary care provider. So we have a lot of work to do in our communities. We are really focused in on making sure that folks who are in the Roxbury, Dorchester community that are surrounding the church get the help that they need. So we want to be supporters in providing the church for any of the needs that Whittier Street may have, and we want to make sure that we live up to this motto that was talking about comprehension, compassion, and community. So we want to be there to support this initiative, and I know that Art would have loved to be here, but we are so happy to accept on his behalf. Thank you.
Thank you. Our next honoree is another friend of mine that I've known for many, many years, David Morales. He's the general manager at Unicare. David oversees the management of Unicare's commercial and Medicare plans offered to the group. Maybe Portia, we can have him over at the church, the Medicare plan, with the GIC members. He also collaborates with healthcare providers, elected officials, and other key stakeholders to drive improvements in healthcare access and outcomes. Previously, he held several public service roles, including Massachusetts Commissioner of Healthcare Finance and Policy. Additionally, David implemented and operated the first prescription drug insurance model in the US, the Prescription Advantage, which served as an incubator for Medicare D and was the co-author of the legislation which launched the Massachusetts Life Sciences Initiative. Through his life and work, David serves as a role model to many, and we are grateful for his long-standing friendship. I worked with him when he was at Steward Healthcare, when he was over at the State House, and we are grateful for your leadership and support. For your compassionate community service and leadership, David, we're presenting you with this long overdue award.
Good morning. Good morning. All right. I'm wondering if people were paying attention. I'm just kidding. Look, it's an honor to be here. I've been thinking this morning, what would I say at the podium? And when I saw my friend Magnolia Contreras walk in this morning, I know what I'm going to talk about. She's another champion, by the way. Yes. Absolutely. Absolutely. The theme that's consistent this morning for me is faith and family. Faith and family. My family's faith in Christ brought us to the United States in 1986, trying to seek our way out of poverty. I come from a long family of strong men and women in the Caribbean who are pursuing better. Frederica and this organization represent faith and family. And as long as we anchor ourselves on those values, faith, my faith in Christ, family unity, people that support each other to success, and hard work, we can achieve all things. So Frederica, thank you. I'm honored to be here, and I'm blessed to have received this award. Thank you all very much.
Our next honoree is our very own Jean Prizeau. So Jean came to Whittier as a men's health ambassador and was promoted to being a care manager. He is one of those unsung heroes. And if you ever get a minute with Jean, he will tell you so much about Whittier that even I am like, can we turn it? He is just he's so passionate about his work. As a men's health ambassador, he gets to go to the prisons, to the hotspots, to the homeless shelters, to Mass and Cass, and Jean can convince anybody to take care of their health. And he keeps saying to me, we have to be bigger. I said, yes, and so that is where he has a vision that is big, he is passionate, he loves. Jean shows up in the insurance enrollment with 5, 6, 7, 8 people that he would, and then he'll transport them to DTA, or he'll go to the Department of Transitional Assistance. Wherever he captures you, Jean will get you connected. He's originally from Haiti, was a school teacher. Now when I read and I could see, because every time I speak to him, I'm learning. There are 400 of us, and Jean is just such a wonderful, wonderful ambassador for Whittier Street Health Center. Jane, we're so thrilled that we get the opportunity to thank you in front of everyone for everything you do every single day on behalf of our community and our patients. I'll give it to your wife. Oh, and you can say a few words.
Take my family, please. Thank you, sir.
What else?
Good morning, guys. I really appreciate you to come. Welcome to Whittier. God bless you. I thank to God first. Thank my wife for your support and being here for me. I thank you for this award, Ms. William, Whittier Street Health Center. I was not born with a silver spoon in my hands. I was born with my heart good. I have dedicated my time and life in helping the unfortunate and all those who are in need of assistance. I asked for nothing in return. I love my job. I love my colleagues. I love my colleagues in my heart because we as a team have been told how to care, listen, and help those in need. I love Whittier. I love Whittier again. Whittier Street Health Center is the best place to get any services. I love Whittier because it stands for what I believe in. Thank you, Ms. William, for your leadership. Yes. To do the job. God will bless you. In closing, I would like to take this time to thank special person, you guys coming here with myself. Special person that came to in my life has been my mentor, Bob. Dr. Christine, Dr. White, all of you guys, the funders, every department, I love you. We need to communicate. We need to communicate to increase Whittier Street Health Center more. I thank you, boss. I thank you, boss. I want to tell that. So, my dear brothers and sisters, stand strong. Do not let anything change you. Always give yourselves fully to the work of the Lord. You know that your work in the Lord is never wasted. I accept my award.
Thank you, Reverend Jean Prezeau. Our next honoree is another dear friend of ours. William Watkins is the VP of Digital Strategies and Partnerships at the Urban League of Eastern Massachusetts, a wonderful organization. He manages the organization's workforce development as we talk about jobs and the impact it has on health. With a focus on bringing cutting-edge programming to Roxbury, he successfully attracted the attention of major companies like Google, Verizon, Microsoft, and Comcast by offering coding and graphic design courses for adults. His efforts played a critical role in the implementation of the ACT WorkKeys National Career Readiness Certification System across all the career centers of the Commonwealth's Executive Office of Labor and Workforce Development. He has served alongside several great civil rights icons like Congressman John Conyers, and he actively participates in several organizations, including the Board of Bar Overseers, the Society of Human Resources, and the ACT State Council, New England. William, for all you do to bring jobs and trainings and skill development to the residents of Roxbury, we're grateful for your service and present this award to you.
God. So, before I begin, I want to thank 3 individuals who, during the pouring rain of Juneteenth, I asked President Williams to be a part of the Juneteenth celebration so that we could increase the number of individuals signing up for Medicaid, because you know this is that open enrollment period, and we could stand to lose ground. We could stand to lose lives. So it's very important as you speak to people, talk to them about Medicaid and making sure they sign back up. Institutions like Whittier depends on that. But before I begin, I want to thank Luigi, Elizabeth Sanchez, and Yalis Baez. Those young ladies over there helped me out in the pouring rain. I'm just a humble servant. I tell people, when you look at my birth certificate and it says, where were you born? It says Roxbury. It doesn't say Boston, it says Roxbury. As President Williams described, I'm a lucky young man who lived in the projects and was able to be as close as I am to this lectern to the President of the United States, Bill Clinton. A kid from Roxbury. I went to a historical black college. Mary McLeod Bethune, that little school down there, with $1.50 and 4 little girls. I'm one of her sons. But before I went to Bethune-Cookman, there was this poem that she had written, and I apply it to my life every day. And the poem is The Drums of Africa. It says, the drums of Africa beat in my heart. They will not let me rest while there's a single Negro boy or girl without the chance to prove his or her worth. That's my life. That's my duty on this earth. So when I see an institution like Whittier speaking in advance of the pandemic, the importance of health equity, they was on the front end. You know, I'm like Gene, let's go big or go home. Men's health is critical. It's critical. That's why we don't have men in the homes, because of the health, mental, physical, spiritual. Okay? When I looked at the list of disparities for men, and cancer was high, I say to myself, why do we not have a cancer research center in Roxbury? Okay. Put it where the pain is. We're working on it. Okay. The next I say is, and I'm a diabetic, and I can tell you I'm a little successful. I don't like going over to Longwood. So I know personally, if I feel that way, someone who may not have the means that I have, how do they feel? We need to have a diabetes clinic.
We do.
That's right. A standalone, just like Leahy. I mean, not Leahy, that other place. Jocelyn. It should be right in the community. And I'm going to close with this, and I've realized, just working in civil rights, and I may have some people not like what I say, but I'm going to say it. There were institutions in our communities. We had hospitals. This was during segregation. We had hospitals. We had some of the great doctors. And once desegregation happened, a lot of those institutions went away. We have to rethink and retool if we're truly going to address health equity. Those institutions have to return back to the place of pain. If they don't, we're still going to be going around in circle like that hamster on the wheel. I thank you, Madam President. Your vision, you're intentional about talking to black men. Your intentionality grows us expedition. And I want to leave you with this. When I said to myself during COVID, I said, I can't wait to go back outside. Because when I go back outside, I'm going to love on people more. Okay. if anything we learned in COVID, when we was locked down, we had to learn how to love with that one another, me, your dog, be it your significant other, your spouse. You had to learn in those 3 years how to love. Because God wanted you to return outdoors and be of a loving spirit. And I could tell you, Dr. Williams, you and your team, and that's why I wanted to acknowledge those young ladies. Y'all have a loving spirit. Thank you.
Wow, that was wonderful. Unfortunately, Levet, you're like me. With wing, W, I'm always last. I had a listing the other day, someone listed me with my first name, and I thought, oh my God, I made it to the top, because I'm always last. But definitely last, but not least, Levet Wing is the president and CEO of the Commonwealth Seminar. He has led the Commonwealth Seminar since 2015 after being one of the founding board members in 2003. Previously, he led the Community Services Division at the Massachusetts Department of Housing and Community Development. He was also the executive director of the Washington, D.C. headquartered Asian and Pacific Islander American Vote. Prior, he helped spearhead an effort to create the Massachusetts Asian American Commission and was later named the Commission's first permanent executive director. He sits on several boards, including GBA TV Radio, where he founded the station's annual Asian American and Pacific Islander Heritage Month celebration in 2006, and now is an annual event. You should all get an invitation, I guess. And I hear he was also a mentor to someone who may be a mayor of Boston. So he's touched so many people. So Levet, for your work in leading in the Commonwealth and for your contributions to the BIPOC men that we serve, we present you with this award.
Thank you, Federica. You know, again, my name's Leverett Wing, and what always happens, because my name ends in W, as Federica alluded to, I always end up going last. And I always worry, you know, I look at a list, you know, during a speaking program, if it's an awards ceremony, and I think, oh man, how am I gonna follow this? And then, so when I looked up the names, and I looked up, I mean, I know my longtime friend Dave Morales, he and I have been working together for ages, but then I looked up what everybody did, and I thought, there's no way that I can follow all these people. I'm just gonna grab my award, and I'm just gonna sit down and not say a word. But, yeah, but I can't do that because I think I'm gonna follow up on what David did in terms of a theme. My theme today is cherish this room. Rooms like this don't just happen. They happen because of people like Federica. They happen because of organizations like Whittier Street Health. They happen because of her team like Jean and Deborah and Christine who helped put this event together. They happen because of people like you and all of us together. And so, you know, I am grateful to be here. I'm gonna do something that my wife can't stand. Now, you know, but you know, she's not here. Because it's our son's 20th birthday, so she's home spoiling him to death. And so appreciate this age over here because I have not gotten a hug in 9 years. So appreciate this age here. So I'm going to do something that she can't stand, which is put y'all to work. Now, you know, what I'm going to ask is, you know, rooms like this don't come along easily. And so when we're in a room together, let's take advantage of that. And so what I'm gonna do is I'm gonna ask everybody after the panel and while we're eating to go out and meet 2 or 3 people that you don't know. Because, we all know this, there are people, there are organizations, there are elected officials trying to pull us apart. And so what we need to do is we need to stay together. And to stay together, we need to build bonds. We need to build alliances. We need to build cross-community connections. And the way to do that is by taking advantage of opportunities like this. You know, the expertise, the leadership, the energy. You walk into this building. I took 2 steps into this building, and the energy in this room and this building was incredible. So take advantage of the energy of this building. And you know, I've got to call out, you know, my longtime friend Juliet Mayers, who was doing the book signing. Meet Juliet if you haven't. You know, meet my, although Whittier Health, Gerald Bell, who I used to work with at Department of Housing and Community Development. I don't know if he's here, but Dr. Guy Fish from, there you are. Dr. Fish, he's the president and CEO of Greater Lawrence Family Health Center, who traveled all the way down here. Get to know him. I mean, I figured, what a great opportunity for 2 incredible health centers to get to know each other and to build collaboration and to share ideas. So this is an incredible opportunity. I thank Frederica, I thank your staff. The energy and the love and the passion that you and your staff and your team bring to this is so evident. And so I ask you all, cherish this room, cherish this opportunity, and cherish each other, and cherish this very, very special day, because it really doesn't come along that often. So thank you all for being here.
Beautiful. Thank you so much. Let's give all of the champions a round of applause. Thank you. So now it is my honor to introduce to you our speaker for today, Glenn Jones. Glenn, I forgot to tell you, Jones is my mother's last name. So somewhere, see, now you're in that village, you're not going anywhere. Glenn Jones is an evening anchor at NBC Boston and joined the station in November 2021. We were doing a COVID vaccination on New Year's Eve night on December 31st, 2021. And that's how I met Glenn. There were all these reporters in front of me interviewing me, and he asked a lot of good questions. So I put it in my head and said, I gotta find this guy. I didn't know where he was from. Do you know the person that just whispered to you? That's Latoya's dad. I know now. Okay, now you know. So Latoya is our Roxbury girl who grew up here. So I texted Latoya and said, I'm looking for Glenn Jones. I just saw him on TV. And she said, I'll connect you. So Glenn is a past Boston, New England Emmy Award winner. He has nearly a decade of experience in television news. Glenn spent 4 years as an anchor and reporter for the NBC affiliate in Fort Myers, Florida, and at the NBC affiliate in Springfield, Massachusetts as well. After his departure from local TV, Glenn worked as Bermuda's press secretary, where he led crisis communications and media relations for the country's highest elected office. He also worked as the interim CEO and Chief Experience Officer for the Bermuda Tourism Authority, where he led a multi-year tourism plan that reshaped the country's hospitality industry. If you haven't been to Bermuda, you have to go after the work that he's done. It is now, he reports exclusively on issues of diversity, equity, and inclusion, and we thought he was the right person for today's event. So please join me in welcoming our friend, Glenn Jones.
Good morning, everybody. Good morning. It is good to be with so many healers here today. I didn't expect to feel so many feels coming to this event, but meeting all the people who are being honored as men's health champions is really, really an honor. So another round of applause, please, for the champions. Now, let me do a disclaimer to get started here. I'm a fish out of water standing up here before you today. You're healthcare professionals, you're supporters of men's health and health equity. I like to refer to a room like this as a group of healers, such an important role in our community and in every community. I am not a healer, I don't pretend to be. In fact, when my colleague, Latoya Edwards, introduced me to Frederica Williams a couple of months ago, I was shocked when she asked me to speak to all of you today. I told her, speeches aren't really my thing. If you need an MC, I got you. But speeches aren't really my thing. Besides, it's been my experience that if somebody puts me in front of a microphone without a teleprompter, anything can happen. Nobody wants to see that. So Frederica should have been very afraid. She should have been terrified. But she wasn't. And I think most of you know she doesn't take no easily. And so here I am. So I did accept, and I'm really pleased to be here. So I like to describe my job at NBC 10 as a storyteller of current events. That's the gig. And to perform that job well, you need two skills to be very sharp. They are curiosity and observation. I'm not out in the community every day like our reporters are, but when I am, I try to match those two skills with an eye to seeing things from a new perspective and asking questions shaped by my own personal experience. It's a baseline for good reporting. That's been my experience. And when I look back on my reporting, what trends bubble to the top? And how do we ensure our audience understands what those trends are? When we get the job right, we're holding up a mirror to our community. We present facts unflinchingly. We tell truth transparently. So just to make sure you're picking up what I'm putting down, exude curiosity, observe relentlessly, embrace a new perspective when it emerges, and analyze the trends. That's good reporting. So those are the stepping stones that I think kind of brought me to the crossroads that I am today. It's really relevant to our discussion. It's sort of the reporting I've been doing and health equity. They have sort of crashed into each other in the reporting that I've been doing. So we need to understand why that is. Although I haven't known Frederica for very long, when I came to understand her mission in our community, I recognized it immediately. I knew exactly what this crossroads is. It's very familiar to me, and it is consistent with what I've been observing in our community. I'll tell you a few stories. In April 2021, along with a veteran producer and photographer at NBC 10, we got curious about why there were so few black runners in the Boston Marathon. Every year, there's a camera fixed at the finish line on Boylston Street, right outside the Boston Public Library. You've probably seen it before. And it captures all the runners coming across the finish line. And when you look back at many years of that finish line, there is relatively few black runners. Now, to be sure, the first people across the line are black. Africans, mostly Kenyans. They're the first ones across. But the point I'm trying to make is very few African Americans, very few Bostonians, very few black Bostonians. So why is that? We got curious. It's an iconic race in one of the greatest cities in the world. It's an iconic It's an iconic experience, but black people from Boston are uninterested or at least underrepresented. So we tried to quantify that with the Boston Athletic Association. And they didn't have really good data on the racial breakdown of participants. Either they didn't have it or they didn't want to share it. To their credit, they support many community organizations that promote the sport in underserved Boston communities, but they couldn't or wouldn't share the data that allow us to examine whether their support of those organizations was actually resulting in more diverse runners participating in the marathon. One of the groups that they support is a group called Black Men Run. I reached out to the group's leadership, and before long, I was embedded in one of their weekly runs with the goal of telling a story about how they work to increase diverse participation in the Boston Marathon. So it was partly supposed to be a first-person account where I put on some sneakers and I went running with these guys to see what it was all about on a Saturday morning. It was great. It didn't feel like work. I had a blast, even as I struggled to keep up with some of it. I mean, it was really like entering a brotherhood. I felt at home. But as I turned to my powers of curiosity and observation and to be open to a new perspective, I made a discovery. We set out that day to tell a story about how Boston Black Men Run was providing a support system for black men who aspire to run in the Boston Marathon, and to be sure, there were a group of men with that aspiration. But the group's co-captain, Jeff Davis, was very clear with me about something I hadn't expected. And when he walked me through it, I knew that our storytelling lens was focused on the wrong thing. He told me, much like Frederica did a moment ago, that if you live in the Back Bay, an enclave of success and privilege, your life expectancy is 91 years. But if you live in Roxbury, a black community with a far lower average income, your life expectancy is 58 and a half years. So that meant in a distance equal to the one we just ran on a Saturday morning, life expectancy is 33 years shorter. 33 years. Or to state a generalization that probably has crossed your mind just as I'm speaking, our city's black population is losing out on a whole generation of life compared to their higher income counterparts. To the people here at the Whittier Street Health Center, and probably to some of you in this room, that statistic isn't all that surprising because you see these data points in the patients you see, in the faces that walk through the door. However, to someone outside of your universe like me, it stopped me cold. It took me by surprise. It demanded my attention, and I remember thinking, doesn't it demand everybody's attention? I also started to wonder if the burden to fix these health disparities is a social injustice we all must bear, not merely the healers. Surely this can't be your problem to solve solely. And if I'm reflective, this was a realization that made it easier for me to ultimately say yes to Frederica's invitation. And here I am. And I appreciate that speaking with you is like preaching to the choir. As I explain my personal journey on discovery of health equity, I appreciate that these are things that you already know, but here's what I have also determined from a professional perspective. Whatever platform I am blessed to have, it should be my responsibility to use it to make a positive impact on my community. If I'm going to decide the burden to address these disparities is our problem and not merely your problem, maybe the new perspective worth embracing is this: I can be a healer too. Amen. I suspect Jeff Davis, the Black Man Run captain I told you about a moment ago, an HR professional, a talent recruiter, a really good 400-meter athlete in his day, he falls into that category too. Like me, he doesn't work in healthcare, but he cares deeply about the health of his community, so he's out there trying to heal in his own special way. He's a healer too. Maybe we all are. Many hands make light work. When we were shooting our story on that Saturday morning, he said this about the regulars who joined the weekly runs. If people want to do a marathon, fantastic, he told me, but that's not the bar of success for us. I think the bar of success for us is building a movement where Black people specifically can see themselves investing in their health and feeling supported in that process. So remember, we were there to do a story about diversifying the participants of the Boston Marathon, and while that is an important subject, it felt minuscule compared to this much bigger problem Jeff was articulating. Needless to say, health disparity, health inequality became the focal point of our story that we reported. We pivoted, and I hope we used our platform for good, delivering information most of our audience did not know. We hopefully raised awareness. So this seems like the right moment to talk about progress. The life expectancy statistic in our Black men's story is about 10 years old now, as Frederica was laying out. 6 weeks ago, the Boston Public Health Commission updated life expectancy numbers based on census tracts, and once again comparing the Back Bay and Roxbury. Life expectancy in Roxbury is unchanged. It's still at 91 years, but the life expectancy in Roxbury has improved measurably by an entire decade, from 58.5 years to 68.5 years. And on the one hand, of course, that's a tremendous improvement from where we were. It's remarkable, actually, but it's hard to take a victory lap when the health disparity gap shrinks from a gulf to a canyon. You know what I'm saying? Either way, it's still a very, very long way to go. It's less than 3 miles as the crow flies between Back Bay and Roxbury, and metaphorically, you can't walk there or run there on a Saturday morning. I tried with Black Men Run. The goal is much more complex than geography, but I'm still convinced we can get there. The pace is going to be slow, but we can get there. It's not too optimistic to say the life expectancy improvement is a strong signal that all of us are on the right track. We're moving in the right direction. And now we need more people to join the effort. That would allow us to pick up the pace. The work that happens here at Whittier Street Health Center is unquestionably one of the engines powering that accelerated pace that will lead to better health outcomes for more people. I've been inspired to meet some of Frederica's leadership team. Medical Director Dr. Stephen Wright. Oh, there he is. CFO Jim Lee, I met the last time I was here as well. And Community Relations Manager Bob Edwards, who's already been heralded here this morning. Everybody here are all certainly part of the many hands making work lighter on the way to health parity. Frederica has also been educating me on Whittier's health equity program, part of a 5-year strategic plan. There are many goals under that program, but this one is the biggest promise. Eliminate health disparities associated with race, ethnicity, environment, and income in communities that have had a heavy burden of health problems. The goal is ambitious and articulate, and it is even audacious. And if Whittier Street Health Center was the only player in the game, I would call the mission impossible. Too large for one organization. But I know in this city it's a shared goal. All hands on deck. As one example, I've read about the Health Equity Compact, and what I read is exciting. The goals feel just to me. I am anxious to learn more about what they accomplish. Trust me, I'll be watching. There are so many out there doing great work. Just a couple of weeks ago, we had a story about Dr. Alistair Martin, an ER doctor at Mass General. He's an advocate with an organization called A Healthier Democracy. They have a few relatively simple goals, and they go like this. 80% of health outcomes have more to do with things like environmental conditions, housing, and food insecurity than they do with clinical care. People victimized by poor health outcomes are better positioned to instigate change if their voice in our democracy is stronger. Healthcare workers are trusted messengers. Healthcare workers are trusted messengers. It's the last point for me. Politicians, even media to some extent, don't enjoy the level of trust that healthcare workers have earned. I have to believe trust is the preface to change. When Dr. Martin is treating patients in the ER, he's also offering them a chance to register to vote using a kiosk right there in the emergency room. It's a nonpartisan invitation. He helps them understand how their vote may actually prevent their next visit to the emergency room or their child's. Dr. Martin tells me there's a shocking correlation between communities with low health expectancy and communities with low voter participation. He believes strongly if we can raise voter participation in the most underserved communities, we can improve their health outcomes too. A Healthier Democracy has voter registration kiosks in more than 700 hospitals and clinics across the country. They've registered more than 80,000 patients to vote. It's pretty remarkable what trusted healers can do. I explained the life expectancy aha moment I had when out there running with Black Men Run. In this case, here's what grabbed my attention. Healers like Dr. Martin are not only treating ailments in the ER, but also treating the root causes of those ailments. That's really important. That really does feel like a prescription for shrinking health disparity chasms wherever they exist. Once again, more hands making light work. It'll take a while, but progress feels inevitable. The stats I cited earlier give me hope. Health inequality in our city and indeed across the country is a massive social injustice that needs correcting. That's urgently true today, and it was urgently true 10 years ago. All the evidence suggests you're making progress. We're making progress. Even in my small microcosm of my reporter's notebook, my observation is this: the trend of health disparity is bending toward equality. But let's not celebrate too much. There's much work left to do. We need more hands. That's how we double down on our progress. That's how we pick up the pace. I accept my responsibility to use my platform to raise awareness about the work being done. Black Men Run, A Healthier Democracy, I see you. Thank you for what you're doing. I also accept responsibility to raise awareness about the progress being made and the people who are making it happen. Men's health champions in Whittier Street Health Center, I see you. And perhaps most importantly, I'll raise awareness about the work left to do. In the past decade, we've lived to see the life expectancy disparity here in Boston shrink 33 years to 23 years. It would be the thrill of my career to one day tell the story of how we watched a community use every available hand to shrink that gap all the way to zero. Let's get after it. We can do it. Thanks very much.
Let me just say that with curiosity, your storytelling skills, your observation, your discovery, your attention to issues, the responsibility and the call to action, you are a healer. You are, if we have more people telling the story, how we actually brought out this issue. The City of Boston puts out the Health of Boston report every year. And when we saw the 59 and a half years compared to 92 years, again, we thought this cannot be correct, so we started calling around. But the folks that got the message out and really made it such that everyone started talking about it in 2012 were reporters like you. The Latoyas, Chronicle did a story, The Tale of Two Cities, and folks started. So we, as you said, were small organizations, so many community health centers. One of my colleagues here, Dr. Fish, in every one of our neighborhoods, we take health equity very seriously, but we need you, Glenn. You are part of the healing circle. And you know, when you're in the Whittier healing circle, Jones family and all, you're in it forever. So we have those, you know, focusing attention on it. So again, thank you so much, Glenn. I know Saturdays are usually busy times, and you are Hila, you are a champion, and we wanted to present you.
Thank you very much.
So now, moving along, I'd like to ask Medical Director Dr. Wright. Oh, okay. You're over there. Hey, all right. He's standing in position. Dr. Wright, I was telling him over and over again, it takes a special kind of caregiver to work at Whittier in our community. We think big, like Jean, gotta be big. We believe we can do all things. We want to partner with people. And Dr. Wright, I've been the CEO for 22 years, and he has been on our team since 2014. And patients relate to him, connect with him. He is humble. I hear so many stories. Don't ask for a raise on Monday now. But he is just such a very special person, and we are just so, we're a family here of people who believe that we can close gaps and can do things. So Dr. Wright will join me at the podium to lead the panel discussion, and he'll introduce the panelists. Thank you, Dr. Wright.
Thank you so much, Ms. Williams, and thanks to all of you friends, family, staff members, our honorable members of our board, Ms. Williams, Pastor Bell, patients, community members. Thank you so much for this opportunity to bring this important information to you. I'm going to jump off script just for a moment and then jump back on, but I just wanted to point out that there are so many common themes that we're hearing about this morning or this afternoon. One of the biggest things that I've been picking up is the energy that our speakers and our champions have, the passion that they have for what they're doing. It's incredible. Go big or go home. It's amazing. And also, these gatherings are fantastic because it gives us a chance, number one, for us to come together. When we come together like this, and we can feel the energy, we can get that passion, it gives us the ability to move forward and to take care of what needs to be taken care of, which is better health for our community. That really is where it's at. And also, it gives us a chance to look at these different perspectives from a different lens, so to speak. I'm a provider here at Whittier Street Health Center. I love it here. This is my home. I've been here for 10 years, and I can't imagine being anywhere else. But my perspective on this issue that we're going to continue to delve into is from a provider, a medical perspective. And it's wonderful to hear the different perspectives from people. It's the same problem. We're looking at it from different angles. And we hope to get some solutions. For that, I thank you. I'm going to jump back on script right now. And I want to thank you, and good afternoon. It is an honor to stand here before you today at this esteemed Men's Health Summit, where we gather to address an important issue paramount to us, health disparities, particularly that persist among men of color. I want to extend my gratitude to the champions recognized today, and also our panelists, Dr. Crawford, Mr. Hilton, Mr. Donnie Lee, and Dr. DeMartine. We'll be hearing from them, and I'll ask them each to give a little bit of blurb about what they do, where they do it, and how their positions give us a sense of what can happen to make this change. As we delve into the critical topic of health disparities, it is imperative that we recognize the challenges faced by men across diverse backgrounds, including but not limited to race, ethnicity, socioeconomic status, and geographic location. Today, we aim to shed light on these disparities, identify the underlying factors, and explore actionable solutions to bridge the gap. Men's health disparities are not isolated issues. They are multifaceted, interconnected. We heard that a little while ago, the connections. And they're deeply rooted in societal factors. Whether we examine the alarming prevalence of chronic conditions, mental health challenges, or limited access to quality care, it is evident that some men bear a disproportionate burden of poor health outcomes. Why is that? And we cannot address this issue without acknowledging the specific communities, such as Black, Indigenous, and people of color, face even greater disparities. Right here in our community, back here. Anything that's going on medically, likely it's worse, it's greater, it's more intensified. The outcomes are not as good. Why? So we're going to be looking at some of those reasons in more detail. So we must recognize that health disparities do not occur in a vacuum. They are the manifestations of historical inequities, systemic racism, social determinants of health, and unequal distribution of resources. To tackle these disparities effectively, we must adopt an intersectional lens. So again, we need to look from different lenses, but we need to come together and focus in on the issue. We need to recognize that race, gender, socioeconomic status, and other factors intersect to shape health outcomes. However, while acknowledging the challenges, let us also embrace immense opportunity before us by engaging in open dialogue, sharing knowledge, and pooling our expertise. We can develop strategies that dismantle some of those barriers and foster transformative change. It's through collaborative efforts that we can empower individuals, strengthen communities, and create a more equitable healthcare system that uplifts the health and well-being of all men. During our panel discussion today, we will explore the root causes of health disparities, examine the impact of social determinants of health, and highlight successful interventions that have yielded positive outcomes. Our esteemed panelists bring a wealth of experience and expertise, and I have no doubt that their insights will inspire us and guide us towards health equity. Let us approach this discussion with empathy, respect, and a shared commitment to action. By doing so, we can pave the way for a future where all men, regardless of their backgrounds, have equal opportunities to achieve optimal health and well-being. And in closing, at this part, I want to thank the family members, the wives, the mothers, the daughters, the sisters, the nieces, for helping men to take care of their health.
Yeah.
Okay. So let's get things started. Why don't we have an introduction of our esteemed panelists? I want to thank you all for being here. And I see Dr. DeMartine, you've got the mic in hand. Why don't you tell the audience who you are? And we're colleagues, by the way, and he's an incredible provider. But I'll let him say it in his way. Dr. DeMartine.
Good morning, all. Good morning. Good afternoon, I think, by now. I'm Doc. It's on. My first name is Joseph, last name DeMartine. And for those who speak French, you could say DeMartine. I am a general practitioner. And now they say primary care physician. I may not look like it, but in my time, we said GP. For me, it's an honor. Every time I come, I take the tea to come here because I live nearby. And when I leave the train station and I look at this building, and I keep thinking, this place has everything that one could imagine for preventive care, to take care of patients. It's all here. And I knew this area when I went to college at Boston University. At that time, it was sort of scary to be walking around here. You know? And this place here, I don't know what the saying is, but it's a light that's shining on a hill.
Yes.
When I called the first time, and I spoke with, it's an agency that recruited me, and I got on the phone with Mrs. Williams. After one conversation, I knew I had to be here. And she's been such a great leader. This is such a place where I've worked all around Boston in all the hospitals. I'm a general practitioner, but also a hospitalist. I've spent a lot of time working at New England Baptist in the ICU. I've seen it all around. But this place here is so special. But I asked myself one question, given the disparity in healthcare, where is the population that used to live around here? I don't see them enough in this clinic. And that's where I'd like to piggyback to Mr. Jones about the need to really communicate and let more people know that this place exists. Yes. Like what Mr. Watkins had said earlier, when he goes to Longwood Avenue, he doesn't feel as comfortable as he would feel here. This is really a comprehensive, compassionate, and it's a real community of people who really care. Me coming back here to work, it's doing more for me in the sense that I grew up in Haiti, went to high school, came here to college, went to BU. I know how things used to be. And as Mr. Jones just said, we are progressing. I think there has been progress. That there is a little increase in our longevity is a really great sign. And I think a lot of efforts are being made. And this place is really an example of what needs, the type of clinic that one needs to have in every community, not only in Massachusetts, in the United States. And I wish I could just lift up this place and bring it to Haiti. Because that's what we need. Now, I won't monopolize this too much, but take it downstairs where I'm working. The other day, a 52-year-old man came in, his blood pressure is over the roof. I was scared, because I said, nothing is going to happen in my presence here. No heart attacks, no strokes, nothing like that. I said, what? I mean, how come your blood pressure is like this? He said, oh, I haven't been here for 2 years. And I said, why? Oh, I didn't have any insurance. But Whittier Street does not say, have your insurance first. So he was processed, I saw him, give him the medicine right away in the clinic. And so, talking about health disparities, as men, even myself, I mean, I think twice before going to the doctor. I am a doctor. You know? So, as men, we think, okay, we can handle it. You know? So, once we make the decision that we're gonna go to the doctor now, do I have any insurance? Do I have transportation? And and then the literacy question. Do I know that I have to take my blood pressure medication regardless whether I feel I have a headache or not? Because it's a silent killer. It will kill you. But a lot of our patients don't know this. So that's very important. So health education, literacy in healthcare is extremely important. Thank you.
Thank you, Dr. Dean. Thank you very much. And Dr. DeMartine has covered many of the topics that we will discuss in question form. We'll move on to Dr. Crawford. Sir, please, if you could just introduce and say who you are and exactly what you do, and we appreciate you for being here.
Good afternoon. Good afternoon. I don't have to get church on y'all. Okay. So there's a couple of things I want to say before I introduce myself. The first question that I have to ask is, do you know the leading health facility, a flagship health facility in Boston? Can you name one? Can you name the leading one? Let's try it again. Can you name the leading healthcare facility that provides the best cross-cultural competency training and care that any patient would want to have?
Whittier
Street.
Okay.
Can you say it again?
Whittier Street.
One more time.
Whittier Street.
Okay, let's get that straight, because that's where we're coming from. So now, the next question I ask you is this. When is Breast Cancer Awareness Month?
October.
When is Breast Cancer Awareness Month?
October.
Okay. When is Prostate Cancer Awareness Month?
June.
No, you know. I got you. Okay. When is it?
June.
June. Who said that? Prostate Cancer Awareness Month is in September. Prostate cancer is the leading cause of cancer death in black men. Not the second leading cause, the number one cause. The reason why I brought up breast cancer is because that's important too, because I'm going to tell women you need to get screened. Okay, so that needs to come up. But I brought it up as a reference point of what we know about black men. The other point is this. 1 in 6 black men will come down with prostate cancer, so start counting. You look around the room, 1 in 6, and if you have a family history, 1 in 5. Okay, so now I'll stop there and just introduce myself. So, and there was something else too. I have to throw a scripture in there. Hosea 4:6. Y'all can write it down. Look it up. Okay, that's your homework for today. But without knowledge, we will die. And I'm paraphrasing that. But that's going to be very important for you to recognize. Without knowledge, we will die. Here at Whittier, you get your knowledge, your healthcare knowledge. So, to kind of give you my background, I'm from a small town outside of San Antonio. I went to a historically black college, Prairie View, Texas. Medical school, University of Texas, Houston. Howard surgical residency, Harvard PhD, Harvard postdoc, Harvard faculty. So when I tell you academic excellence and healthcare excellence, I really mean it. Larger academic institutions are working on improving their cross-cultural competency. Whittier doesn't. It leads.
Oh, all right, all right.
And I say it again, it leads. And that's something that you need to be proud of. So, I just wanted to introduce myself. I wanted to give you those key things meant to remember. And there's one thing I also say. I work for a prostate health education network. Prostate Health Education Network was founded by a prostate cancer survivor who happens to be black, who happens to be a 23-year prostate cancer survivor, who happens to have founded Finn 20 years ago. Not only is he well recognized, but he sits on the board of the Dana-Farber Cancer Institute. And so the point that I'm going to bring up is this. If you need to call, call. And if you call, at a minimum, I'll call you back within 24 hours. Because that's what we have to do. And so you know about being on call.
Yes, sir.
You're on call. Because there are not that many black men of color that are out there. So we always have to be on call.
Thank you very much, Dr. Crawford. Mr. Johnny Lee.
Good afternoon, everybody. Good afternoon. I need a little louder. I came with my son on my day off. Good afternoon. So I'm somewhat fairly new to Whittier, but I'm not. I was a patient here before I was actually a staff here. So I work for the engagement center, the little building you guys see right outside when you come in. And my job, I honestly could say I love it because I was once one of the clients that I served. So when I come to work, I come with a passion to it. It's like, all right, cool. My challenge is to make somebody do something productive. If I don't care if it's one thing, but just something. So it's like I come to work. I love where I work. I'm finally getting to know a lot of the other colleagues and staff. And just here, it seems like it's a family thing. So it's like, you know, they're big on that. I deal with a hard population. And I say hard not because of their actions and stuff like that, but just because it's a delicate population. Because you yourself dealing with certain stuff that they deal with that you can relate to, you have to still keep a straight face and still, like, you know, keep it, you gotta stay focused to where it's like, hey, I can't let this affect me all the way, but I need to do my best for them, the client, because I can relate to a lot of stuff that they're going on too, so it's like, I enjoy my job. I enjoy actually coming to work to come and help people. My biggest accomplishment is in the room, which is my son. I didn't go to college. I didn't do any of that, but I made a few mistakes. I learned. Mental health is definitely something that is not spoken about a lot. You know what I mean? A lot of times it's frowned upon, especially in the community where I'm from. I'm not from Roxbury. I am from Mattapan, respectfully. But it's just in a community period, it's just something that's frowned upon. We look at it like, I'm not going to see a therapist, I don't want to do this. So it's like, this is big. So I'm honored to be here, and I definitely wanted to make it a point to come here so I can get some information and my junior can get some information.
All right.
Now I'd like to introduce Mr. Jay Hilton.
I'm Jay. I'm a case manager and peer support lead in the IDSP department. It's infectious disease and special populations. I'm very proud to work in the department. Like Donnie, I'm also new to Whittier. And also like Donnie, I'm a person who has walked both sides of the patient and provider spectrum. So before I came to Whittier, I worked in laboratory, and before that I was a patient, and I'm still a patient in therapy and case management, not at Whittier, but outside Whittier. So I see both sides of the story, and I benefited tremendously from the process that Whittier uses with the clients here, and so I implement what I've received in the practice that I use here. And I'm bringing some of the best practices that I've seen at other institutions, incorporating it here, and seeing what Whittier does, the best practices that Whittier has here, working with primarily BIPOC populations, and incorporating it into my practice. And as a Black and Puerto Rican person, I see that building community is the best way to provide the best clinical services for the people that we have and that we serve. I don't want to go too far.
That's good.
Thank you.
Thank you very much. Thank you very much. So as you can see, we have a very diversified panel here. We're going to have a different lens through which we can look and focus on the problem of health disparities. And let me kick off the first official question. And also would like to let you know that you'll have an opportunity to ask questions. If you have questions or comments or recommendations after each one of our speakers. So this should be an interactive type of discussion, okay? The first official question that we have is, in your experience, what are some of the barriers men experience in accessing health care? And the second part of that is, and please expand on how you believe these barriers contribute to health disparities. So, why don't you take it?
Yeah, I'll definitely start with that one. Like Donnie shared, with therapy, there's a big stigma in Caribbean and Black communities for men to start going to and attending therapy and continuing therapy. When I first started going to therapy, it was really hard for me to continue with it and apply what I was learning. When I was telling my partner that the behaviors that I was trying to change were toxic behaviors, I was being told that, oh, you're not being masculine anymore. And that was really hard for me to handle, being told that I wasn't masculine. As a gay man, struggling with masculinity is already a struggle. So continuing that was something that I struggled with. But it was beneficial for me to have a therapist on my side who could help me with that struggle. So that's one barrier that I wanted to talk about. Another one is staying healthy physically. Exercise is something that's so hard for our community. And losing weight as a bigger person, just starting going to the gym is something really hard. And having community, again, is so important. Having a gym buddy to go with is something that we can work on. Because exercise when you're not thin isn't easy. When society tells you that being thin is the most desirable thing, and being a bigger person, I used to be a bigger person. Going to the gym as a big person isn't easy, especially when you go by yourself.
All right.
So I don't know if I could show pictures to my colleagues, but I used to be a big person, and now I'm not. And it took a lot of work, it took a lot of discipline, and it wasn't just work and discipline, it also was the community that I had that encouraged me, that kept me going, eating right, eating healthy. So I have my friends and family to partake that I can say that they help me with that. I also have one other thing to say to that. Somebody mentioned earlier that behind every Black man, there's a Black woman supporting them. And I have one of my biggest supporters here today. My sister is right here. Give a round of applause. Every step of the way in my journey in life, in my struggle with mental health, with employment, she has been my biggest supporter, no matter what. She is my cheerleader in everything. And so with my education, with my employment, everything. She has my back, and she's one of these black women who supports me. And I know every one of us up here has a black woman who supports us.
Thank you very much. Let's have Mr. Lee, can you answer the same question, which is, in your experience, what are some of the barriers men experience in accessing health care?
In my experience, one of the most common barriers men experience in accessing healthcare is a lack of common knowledge. And when I say that, this can range from how and where to obtain basic health insurance. It can come from how to fill out a form. Somebody said it earlier. Matter of fact, my guy up here in the right said it earlier, and it's crazy that he said it. Medical terminology such as PCP. Sometimes the simplest things as terminology can throw somebody off or intimidate people like myself to where it's like, hold on, I don't know what this means, I'm unsure. When people are unsure, they usually take flight, and that's what happens a lot of times. A lot of times, we men of color and those re-entering society tend to only know a few beneficial three-letter acronyms such as SSI and EBT. We can't forget the IRS though either. But honestly, I feel as though the lack of common knowledge will continue to be a barrier as far as the health disparities if we don't find other ways. One of those ways is what we're doing right now, building rooms like this, speaking about it, because all of us have a platform, like the brother Glenn said earlier. All of us have a platform. It's up to us to use it. So whatever information you do get from here, or when you do have a trip at the clinic or whatever, it's up to you to go out there and spread the news. We're the community. This is Rockland, this is Boston, we're the community. We have to be the ones going on and spread that. So that might be something that might help moving forward.
Excellent. Thank you very much. Dr. Crawford, in your experience, what are some of the barriers men experience in accessing health care, sir?
Well, one of the major experiences is when we walk down, just the fear that you're supposed to be a man. So when I was a kid, suck it up and get tough. And so even in life, our society shapes us and says, well, you need to have a softer side. You need to show your emotion. But then when we show our emotion, we get slapped back.
Amen.
And so we need to have a safe place to acknowledge that men can hurt, men can be sad, and still feel as if our loved one, our family, our community will still look at us as a man. And it's not just a man, just look at us positively. Because that's what we're talking about. And that's not, so that gets you in the front door, because you have to have the right mindset. Next thing too is then getting to that front door, when you look around, you recognize that there are not a lot of people of color in the healthcare field. So when you walk in this door, you walk in and feel like you just walk through just a warm, comfortable place. No microaggression, no negative feeling. And see, nobody talks about that. Because every day you go to work, you leave your house, somebody's hit you. You don't know if they're just a Boston driver, or they're just straight up rude, or they're racist. And so that dovetails into this whole area of racism. And we are afraid to talk about racism. I don't talk about racism to kind of point the finger. I say, yes, racism exists. And racism does require a certain level of mental health support.
Yes.
I mean, think about this. And so a colleague of mine was explaining that people that come from other countries have the opportunity and so are supported about participating in mental health, because folks from other countries come to the United States and they're like, it's racist here. That's not what I said on TV. And this is stuff that if you've been here for a long time, you're kind of in it. And you feel like you're just walking in the cloud and the only thing that you can see is your feet. And you just do your best to keep walking every day to do your job. Go to work, raise money for your family and support your family. So that is something else. And then we also want to make sure we spoke about exercise. We spoke about diet. Because when you go in and say, well, it's like you're going to have to lose a couple of pounds. Crazy, exciting stuff. And I can tell you right now, from the standpoint, there was a gentleman I just want to tell you, and he was using something called radioligand therapy, where it's an antibody or a molecule that specifically attacks the cancer. No, binds the cancer, and it delivers a payload, a radioactive payload that kills it. He was in a wheelchair. Treatment options after that. He had the nerve to sign up for under 30 basketball. So you know we have to participate, and if the medical community doesn't have enough genetic information or information about people of color, we're going to get left behind.
Yeah.
We're going to be on a horse and buggy where everybody else is riding around in a Tesla.
Yes, yeah, EV.
Thank you very much, Dr. Crawford. And research is key, and we're very proud to let you know that we do have a research center right here at Whittier Health Street, where we're doing research in various cancers, as well as some of these social issues that are plaguing our community. And we are looking to get information that it may not necessarily help us this moment, but certainly for our next generation, we can make things better and we can improve things for this community and others. So thank you for bringing that up, Dr. Crawford and Dr. DeMartini. We did have one question over here, and I think we're going to finish after this one question here.
I just want to make a general comment that before all these fine young men here who are basketball league together, and I think the common thread that amongst everyone is that we've all come to education, and of course you guys are still going through school, but we all know that education doesn't stop in the classroom. You guys, obviously the speakers, not speaker thing, you've reached a level that is incredible. Hoping the same for the young generation, but to know that healthcare is for everyone, and thank you for all that you do.
Thank you very much, and thank you for the young man over here. I hope you have a winning season, okay? And at this point, we're going to bring our program to a close. Perhaps,
No. This has just been wonderful. Thank you, Dr. Wright, and thank you to all of the panelists. In fact, Dr. DeMartini is so committed. He wasn't even on the panel, and he decided he wanted to be here. So this is the commitment we have from our providers. And Dr. Crawford, we're looking forward to the research with you. As Dr. Wright mentioned, the Clinical Research Center is right up there. We were fortunate, to your point, we were fortunate through the Biden-Harris administration to receive funding to expand our breast health programming. And trust me, I knew prostate cancer in September, and we're working on it. But, so we're doing that. So thanks to all of you. But I'm also going to embarrass someone who's new and is here, a colleague of mine, Dr. Guy Fish. I was just saying to him, he's been here. Thank you, Leverett, for bringing him. He joined a network of community health centers, and what you hear at Whittier, so many other health centers are doing across the Commonwealth. And he joined during the pandemic, and I said, when we were all in those Zoom squares and all the rest of it, I've been doing this for 22 years. I've been in the community health center movement now for 26, so I always welcome my colleagues, especially men of color coming in, and I wish you 25 more years at your place and continue. So I hope this has been helpful. We want to partner and do more. So again, thank you. I know Saturday is busy, but the fact that you invested a whole Saturday to be here gives me hope. That 23 years, we're going to close it, and we're closing that gap. And we will not be able to do it without you. So together, we're united for men's health. We will make prostate cancer a priority, and we're grounded in equity. Thank you so much. Enjoy the rest of your weekend.